Debate continues in Washington over House Republicans' proposed spending bill. Included in the bill are some big cuts to Medicaid, and those cuts would, if passed, have an impact here in Ohio. I spoke to Stephanie Metzger-Lawrence. She is a journalist with Cleveland NPR affiliate IdeaStream Public Media. She tells me that the federal government pays for 90% of the state of Ohio's Medicaid expansion program, and that Governor Mike DeWine included in his version of the state operational budget that if the federal government's contribution drops below that 90% for the program,
it would immediately end Medicaid coverage for everyone under Medicaid expansion. But it's also worth noting that the State House has made some changes to that trigger language in the budget, according to the Center for Community Solutions, now requiring the state to essentially implement a phased transition plan.
The state Senate is going to have to come up with that transition plan, and she tells me that there isn't much clarity about it thus far.
I spoke with a Medicaid policy expert at the Center for Community Solutions. Her name is Brandy K. Davis. And she says that at this point in time, those details aren't very clear of what that plan would entail to sort of provide assistance to people who could lose their coverage.
Metzger-Lawrence also pointed out that 40% of births in the state of Ohio are covered under Medicaid, meaning that cuts to the program could have a broader impact.
You're looking at kids, you're looking at people in rural communities, you're looking at maternal care. Those communities are very, very much reliant on these dollars.
She also noted in our conversation that the policy expert she interviewed for her story on this
says that people on disability and on Medicaid should maintain their coverage even under these potential changes.
Reporting in Toledo, Ohio, I'm Jaden Jefferson.